Hi everybody, I'm Allison Levin. I'm one of the fourth-year General Cardiology Fellows at Duke and one of the two Chief DCRI Fellows this year. I was really honored to come today to present one of our abstracts on our work with a CDC-funded surveillance network. Today we presented on mortality rates and causes of death in our congenital heart disease population spanning ages 0 to 45. And we worked with this CDC grant across 7 states and were able to report really for the first time on a U.S. population-wide from 7 full states mortality rates and how they were different between severe and non-severe CHD and compare those to the general population. And really gave some, for the first time, hard estimates of mortality over the lifespan, highest in infants, increased over the course of lifespan, with severe CHD having a much higher mortality rate than both non-severe and the general population, and non-severe also having a relatively high mortality rate as compared to the general population. In terms of causes of death, really reported that in infancy, CHD was a major cause of death as expected in the severe cohort, but less so in the non-severe, which was really dominated by non-cardiac disease. And then over the course of life, really pointed out that acquired cardiovascular disease, heart failure, atherosclerotic disease, and other acquired cardiac disease became a much larger cause of death in our severe CHD population, really advocating for much closer monitoring of acquired heart disease that can happen in these patients.